Hi and welcome. I'm trying to learn medicine. Today, atrial fibrillation. And after we've done it, we're going to do backstretching. And if you participate in the backstretching, it's at your own risk. And this is no medical advice. We're just learning about it. And this is about illness and internal anatomy and the blood system. Atrial fibrillation. That is an irregular beating of a heart. The atrium is the chamber of a heart from which rhythmical contractions spread to the rest of the heart. In atrial fibrillation, the contractions lose their rhythm and the heart beats irregularly. Atrial fibrillation may occur in sudden intermittent attacks, but more usually it persists once it has developed. Older people are most affected. Okay, the heart is beating, normally pretty regular. It has a little thing in the middle, but it's more or less like that. An irregular beating of the heart, no. Atrial fibrillation is the problem. And there the atrium, these are the two chambers at the top. From them the atrium is the chamber of the heart from which rhythmical contraction spread to the rest of the heart. Okay, it seems to start in the top two chambers, the atria, and then through the whole heart, from the ventricle also. And when there is atrial fibrillation, when this contraction of the atrium, and it's on the top, the two atria, they're losing their rhythm and the heart beats irregularly. Now I don't have here what it is, but it's not as it should be, but I don't know. It's not as it should be. And that can happen in sudden intermittent attacks. Okay, that is atrial fibrillation. The symptoms are palpitations. I don't know what palpitations are. Shortness of breath, vague feeling of tiredness or being unwell. Sometimes there are no symptoms. Okay, it can be symptomless, but it is palpitation, shortness of breath, and a feeling of tiredness and unwellness. Duration. Intermittent attacks may last minutes or hours, and they may recur over many years before becoming established. Persistent atrial fibrillation lasts forever without treatment. Okay, it seems if there's no treatment happening, then this atrial fibrillation becomes permanent. It is in the beginning over minutes and hours, with symptoms of shortness of breath, palpitation, feeling of tiredness and unwellness, but it can be also symptomless. The irregular beating of the atrium from which the heartbeat goes over through the heart. Causes. Very often no underlying cause can be found. Congenital deformity of the heart is also possible, and fibratoxicosis. We're going to do it by T probably. Okay, fibratoxicosis, whatever it is, can it be? It can be born in, congenital, but there's oftentimes no cause found. Complications. Heart failure with congestion of lungs and swelling of ankles. This will cause shortness of breath, palpitations, and an irregular pulse. Okay, it can lead to heart failure and a congestion of the lungs. I don't know what congestion means. And swelling of the ankles. And the whole thing can cause shortness of breath and again palpitations and an irregular pulse. And also pulmonary embolism is a frequent condition. Treatment in the home. Sit down and rest. When to consult the doctor? As soon as possible, if an irregularity of the heart rhythm is suspected. So if you suspect a irregular beating of the heart, then you should consult the doctor. Do they right here, but again, this is not medical advice, we're just learning about it. What the doctor might do. If the heart is still beating irregularly at the time of examination, the doctor will usually be able to diagnose atrial fibrillation, which he or she will often confirm with an ECG, a tracing of the heart rhythm. I think it's electrocardiogram, doesn't mean. Okay, with such an ECG, an electrocardiogram, they are tracking when the heart beats. They're writing it down. I think that it is a thing which writes it down. So they're checking how often the heart is beating. And if this period where it is having atrial fibrillation happens still while this ECG is measuring it, then it will be detected. If the attack has stopped, he or she will be unable to say for certain what caused it and will look for an underlying cause. Okay, if it's no longer going on, it's not so hard to detect anymore. And then he or she may prescribe treatment to help the heart beat more slowly and efficiently. How is it possible? It would be interesting if there's a medication to make the heart beat more efficiently, as you write it. And maybe it's possible to send the person who has it to a hospital for electric shock treatment to the heart to stop the irregularity. No, I don't know what we mean. As there is a danger of blood clots developing in the heart, anticoagulant drugs may be prescribed. In this case, it will then be necessary for the patient to have regular blood checks. Okay, if people have atrial fibrillation, they have an increased chance to get blood clots, so blood which gets sticky, basically, and when it doesn't flow anymore, it can obstruct an artery, and then no blood and oxygen is delivered anymore to the person. It doesn't get blood supply as it should. And then anticoagulant drugs can be taken. I think these are anticoagulant means, I think, drugs to make the blood more thin, or make this blood clotting. I'm again looking forward to it. Less likely. Prevention. Little is known about preventing atrial fibrillation. This book is 40 years old, maybe there's more now. Outlook. With medical treatment, atrial fibrillation can continue indefinitely without ill effect. That is interesting. That means what we're saying is that if anticoagulant drugs are taken so that the blood keeps thin, it doesn't form blood clots. And if maybe through electric shocks the heart is made in the right way, I don't mean they mean electroshock, I think they mean just specifically then the heart itself. Then they can just continue these atrial fibrillations and no ill effect happens, do they say here. Okay, that was atrial fibrillation, that was the medical part. If you were here for medicine, you can go directly to the next part. We will do now backstretching. If you participate in the backstretching, then it's relatively harmless. Go in 7 cents, you're breathing in left with the arms up. And breathe out and we're going to the side. And breathe in and out middle cage. And breathe out into the middle. Again in. And out over to the other side. Breathe in and out middle cage. And breathe out back into the middle and breathe the arms down. And breathe in. And out, one hand slides down the leg, and the other shoulder sits down. Breathe again in. And out, and we're taking one arm over. Breathe in and out the rib cage. And breathe out into the middle. Breathe again in. And out, one hand slides down the leg, the other shoulder sits down. Breathe again in. And out, and we're taking one arm over. Breathe in and out, rib cage. And breathe again out and bring the arm down. And we go into the middle. We come over to the next exercise. The aeronautic aerobatic aeroplane. Feet are standing together and we're breathing in and lifting the arms open. And now breathe out and bring one hand down. And breathe in and reach. And breathe out the hand again up. Breathe again in. And out we bring one hand down. Breathe in and reach. And breathe out one hand up again. And we're going to do it another time. Breathe in. And out and one hand comes down. Breathe in and reach. And out one hand up. Again in. Out one hand down. Breathe in and reach. Out, hands down. And now we're doing the Marco. Breathe in the arms up. And breathe out the arms back, out the chest to the sky. Breathe in and the arms up. And breathe out the arms down. Breathe in and the arms up. Now overcross your arms to the 20 fingers reach high. And breathe out. And stretch in front and hold up the back. Breathe in and the arms up. Out again back to the shoulder blades together. Breathe in, now across the arms and reach high. Breathe out, reach in front, hold up the back. Breathe in, reach high. And we're ending with a sky hugger, arms wide to the sky. Breathe in, out. And breathe out, lean back, arms wide up. Breathe in into the middle. Out and down, and we're closing with the cactus, connecting its stings. Breathe in, the arms up. Bring your hands to touch, and now hands down to heart center. Now, it was back stretching. It was more short stretching. But thank you very much, and until next time.